vlog of my experience getting tested for COVID-19 or coronavirus. So yeah, just some backstory. I was at an event, a hackathon, an Ethereum London hack by ETH London, or at ETH Global if you want to tweet them. And this was on the weekend of the 28th to the 1st of March. 28th February to the 1st of March. And obviously, I wasn't there for all of it. I was kind of only there for like the first evening. But my sister, twin sister, who I live with, was there like on and off throughout the weekend. So she was in more contact. And this was all fine. But about less than 2 weeks later, we saw a tweet by one of the attendees who said, but they were saying, I've now been diagnosed with COVID-19. I'm currently in Singapore, which is where they're from. Previously, they'd been to an Ethereum convention or event in Paris and something else in Denver as well, which they warned those attendees to possibly get checked because they are now at risk of COVID-19. So, yeah, when I saw this tweet, I actually went batshit crazy. I was at work and I was like, fuck, I could be here and infecting people. And this was probably on Wednesday, so the previous day, which was Tuesday, I'd been to a coding event that was really good. And then I came home and I felt like I had a temperature. I felt really headachy and feverish. So I went to bed early-ish, basically not early at all, let's think under 1 a.m. for once. I'm really bad at sleeping, so yeah. Yeah, and then the next day I obviously went to work and I didn't have my laptop at home then anyway, so I needed to get it. And then I called 111, NHS 111, after work, and they said, if you're out on TFL, go home now, you're at risk, you have a symptom, and you were at this event where there is now a confirmed case that was also at the event, so you need to be tested ASAP. So they took my details and they said that somebody would come to my shared accommodation at the moment to test me. So I was really freaking out, still feeling a bit shit because obviously I have this fever, which was like going up and down, on and off. Don't have a thermometer, so I don't know whether it was bad. So yeah, just going mental. But I knew I was going to wait for the test. My sister obviously also called 111 and she's also at risk. So during the time when we were waiting, they were changing I'm not sure if you can call it legislation or whatever kind of system we have at the moment, where they were saying that the government's response was up in the air. So now they've said nobody, even with the test symptoms and travelling, not everybody will be tested because they really don't have the manpower or the resources to test everyone. But they told us we would be tested. So I called 111 a few times because I was told that I would wait for either 48 hours or 72 hours. So after 48 hours, I called them and they said, we're not dispensing tests, call your local hospital service, which I was told was the Royal London Ambulance Service or Royal London Hospital, one of the local hospitals, and they'll tell you. So I called Royal London Hospital because I didn't see a number for the London Ambulance Service, and they said they didn't know anything about this. They said, we don't know anything about you or your condition, like if you feel sick, call 111, and you've been in contact with someone. They were just so uninformed. It was so embarrassing, like they didn't know anything. I mean, I feel sorry for them because obviously they are short-staffed and the NHS is under lots of issues right now, but I was like, the 111 told me this and I was like, oh no, they told you the wrong thing. And I was like, yeah, I know. Every time I've called them, I've got something different, which sucks. Obviously, it's not really their fault, I guess. But they need to change and shape up a lot. So yeah, unfortunately, that was the case. Like, I called Royal London, didn't get anything. So then I decided I was going to call some more hospitals, and I decided to call Guy's Hospital because my sister told me they were good and they were quite a good hospital. They are also a uni hospital, like they work with King's College and stuff. So I called them. I called their patient advisory service, a line that's stupidly not open on the weekend, but it's open Monday to Friday. And I explained my situation, and that 111 told me I had to wait for the hospital to reach me. And then they said, we've got a pop-up. There is a pop-up clinic in St. Thomas's Hospital, not Guy's. And you can go there and be tested. And I didn't know anything about this, so I thought, okay, cool. Obviously, I told them that I'd been told by 111, so I had been given the go-ahead by 111, at least on Wednesday. So I decided to go to this this pop-up clinic, even though I was terrified that I had coronavirus and that I shouldn't be going out. But it's either that or wait inside and just smoulder away, panic, starve to death if you eat all your food and not find out. And it was really awful because, I mean, I was pretty much sure that I didn't have it because I only had one symptom, plus I was barely at this event, but I was so frustrated, so mad, like, so worried. Like, this person just didn't think about the fact that they travelled so much before coming and potentially infecting many people. And when you think you have it, like, your whole mental health, your whole mental state really changes and gets quite bad. At least for me it did. So that's why I'm seriously warning everybody to be kind to yourself in that situation, but definitely get help. So got to St. Thomas's, and there was a surgeon. Sorry, my hand's hurt. My arm hurts. There was a surgeon who was waiting to go into the clinic pod thing. Me and my sister arrived at the same time as him, and they handed out surgical masks, like, kind of good ones to us. And yeah, he said, I've been treating a patient who's now got it, like a confirmed case, and I might need to be tested, so they accepted him in. They accepted us. We tried to start explaining the whole situation. They didn't know about this hackathon. We showed them the tweet. One woman didn't really want to let us in, but she did anyway. She said you can call 111 or go through the algorithm, which is the NHS website. I can put the link below, but it's not really that good. Just eliminates you based on whether you travelled or you have symptoms from being tested, basically. We came in, like, she shut us up in this room, like a sealed off room. It wasn't really sealed off, I had a door, but they just shut us away from everyone else and told us to call them or whatever. And yeah, so luckily another nurse came in and she interviewed us, and she realised that we were risk cases. So she said she'd test us. So she gave us, like, a phone, and she went to another room and she interviewed us via phone, like, about our personal details, who we were in contact with, and stuff like that. And then she basically said that we were going to get the throat swab, which is what it is. So we waited. We were both interviewed one after the other, and I had the throat swab first. So it's really like this little bit of cardboard kind of stick thing, and they stick it down your throat. So you have to like open your mouth really wide, like you at the dentist or the orthodontist, which I hated. I have a bit of a gag reflex, so yeah, no comment. So yeah, so then we basically had that, and then she did both of us, and then she went away with it. Obviously, we would get the test results, and we'd get an email or a text. So yeah, then we waited for fucking ages because they couldn't let us go home via TfL because it's not their policy. So we had to wait for what I assumed was going to be a car, but actually ended up being an ambulance crew. So it was really kind of scary. Like, they just call it patient transport because they know that if you do have it, you shouldn't be traveling around. So obviously we waited a very long time. They gave apple juice and some strawberry water. And they're really nice to us. Like, she was really nice, this nurse. We overheard a lot of people being turned away because they either hadn't called 111 or they just showed up and kind of were not really sure what this place was for. They just wanted a coronavirus test, and they didn't really have a risk factor. So it's very important that you do call 111 if you want to get tested. Obviously, you still might not be, but we'll see how it goes. It depends how severe your symptoms are. And if you do have it, obviously you self-isolate for 14 days, and then you even beyond that because you could still be infectious. So yeah, we had a lot of people being turned away. It was quite sad, actually, quite depressing to hear. I think there was an Asian woman who may have come in, and I don't know if she'd recently been back from anywhere, but she'd been turned away, and she was like just getting really upset and a bit pissed. We were lucky to even be tested and go to this quite good clinic. So at the end, it was like 8 p.m, and the ambulance took us home. They were really nice. They wore they dressed in all this really scary SWAT team gear with, some filter mask and visor and this bodysuit that went around their whole body. And I was like, God, this is so intense. This is so intense because I wasn't expecting it to be like that, but obviously that is the case if you think you have it. So they kind of don't think we did it. Obviously they found out age that we're 22, we're not going to obviously die. They spoke to us a lot, told us about the fact that there are 2 strains of coronavirus they think they've identified in the UK. The most severe is the Wuhan one, which hopefully isn't in the UK, and that kills people more, I think. No offense to China or Wuhan or anything. So yeah, there are 2 strains, like LNR or LNS, I think he said. And we talked about SARS and MRSA and viruses in general. And yeah, I mean, the perception is it's a bad flu, but it can turn into pneumonia. People with emphysema, people with any kind of issue should try not to get it, and they can potentially really affect themselves. So it just sucks, basically. Eventually because it was quite late, we got to our place of residence quite easily. But yeah, we just ran in, and we thanked them obviously for the lift. I felt bad for like using up an ambulance, but I guess they had quite a lot because it was like a hospital, so they had quite a lot in the car park, courtyard, whatever. Yeah, it was pretty intense and scary. And then obviously I got my result by text about a day later on Sunday, and that was a big, massive relief. I was shocked to get it so soon because I thought I'd have to wait a while. My sister's still waiting for it, which is a shame. I think they have a lot of backlog of test results and they haven't sent them out to everyone. So yeah, that's the deal right now. I mean, it's that serious. A lot of people just didn't really have any risk. They kind of came in. So those people should not be calling 111. Like, only if you've been out of the country or you've been in contact with what is now a confirmed case. Like, this person can't just be ill. If you know they have coronavirus and you're in contact with them, self-isolate and definitely call 111, but you may have to wait for a test. I mean, it really does suck, this whole test situation, because many people want to get tested for peace of mind, especially if you have an underlying condition, but you can't always be, and it really sucks. So yeah, I mean, if I hadn't, I would be really scared to like go home, see parents, see anyone else, because it's, even though I kind of needed to, because I was just like super mentally stressed. So luckily I could, because I was obviously negative, but it really does depend, you know? So yeah, that is that. That's my story. I have some pictures. I have also videos from the thing. Couldn't really record like people getting turned away, but it would have been interesting footage because you want to know why. And a lot of the reasons were they just hadn't done they hadn't done the algorithm. They're not going to test you if you just show up. Like, they have to have this recommendation from 111, or they have to have enough tests. It does seem mean, it does seem cruel. I mean, I understand why they're in this situation. So I hope this was helpful, and yeah, I'm fine. I feel a lot better. I don't have a fever anymore. Still got a headache for some reason. Don't know what I even had, to be fair. So good luck, stay safe, everybody. Wear a fucking mask and do not cough out loud on the train.